like to introduce you to my really good friends, Joel and Joao. Joel is a doctor in Portugal. We met already 5 years ago, started a nice journey together, created all on TRI courses because his outstanding way of treating edentulous patients. And it's really great and a pleasure to meet also Joao Fernandes, the dental technician, because he is really absolutely professional CAD/CAM designer also, and he helped us very much in the project of the Matrix to create the perfect fit. And I would like to welcome you to the stage, Joel and Joao. Very good. Speak.
Okay, so I would like to thank you all for being here, both present and online. And we would like to invite you to a trip to our world, the world, our clinical point of view and our lab point of view. And we're going to go through both analog and digital workflows. So that I can give you a little bit of context, I live in a very small town, and my technician lives 400 kilometers from me. And so some of you, I'm quite sure, can relate to this situation when sometimes you don't have an indoor lab and you need solutions. So let's go also a little bit about this. So straight into our cases. And let's start by an eye aesthetic demanding case. So this was a 56-year-old female patient with a failing crown on the 11 and already a 21 lost to a failed crown. Now, the main problems in this situation, and again, the patient had a really high smile line, so a problem as you all know. We got a wrong zenith position, as you can see here, and we got this massive bone and tissue defect. So I'm quite sure you all agree this is a tough case. Centers are always tough. So we went with a very simple homemade guide, just so that we can understand exactly where our emergence profiles should be in a single region, and so that we can afterwards place these veneers that you see here and reconstruct over it, so that they would always fit in the same place. So we went for the surgery, minimally invasive approach. I will do this every time I can. So in the 11, we have a fresh socket. We use the double trajectory that you all know, and we place our implant. We selected tissue-level implants, okay, for this eye-demanding aesthetic case. So we placed the implant, we respected the space for graft, and we move on with the surgery. We then went for the 21. And again, I opted for a very minimally invasive approach. Very small flaps, doing everything to preserve everything I can in place and to gain what already was lost. So this is the 21 in place, and now you can see the depth of this implant, was so-called multi-level implant, not only a tissue-level implant, in the 21 position. So after this, we can now go with that guide and realize where the veneers are perfectly aligned, and we just reconstruct with composite the palatal sides, adding, like old-fashioned way, using the provisional abutments from TRI. So even if you are not able to do fully digital protocols, TRI got you covered, and you have your titanium buttons that you can use. So after this, I went and did the tissue graft and the bone graft in order to a better outcome in this particularly difficult situation. One thing I'd like to highlight here is that we all agree that we need more or less 4 millimeters of tissue eye in order to have stable tissue. We need 4 millimeters of vertical tissue in order to be stable on your horizontal tissue and therefore stable bone. This is quite clear for everybody. Now, the interesting detail is that if you add up these numbers here, you'll get roughly 3.7, almost 4. Okay? So this is a for me, very important detail that turns your work much easier. And that for aesthetic zone is very interesting, but also for other regions, because it avoids you from these complications that are very common in traditional tissue-level implants in particular. Flat or even in sometimes concave emergence profiles. They are not cleanable. You cannot work with papilla. So this allows you to understand biology. And these are common problems. Lab guys know this better than us. So again, this multi-level implant and all its benefits. Easy to control the implant depth due to that concave shape. You can choose from wider bodies and slimmer implant necks. The concave shape is perfect for accommodate tissue, and it's pink. The freedom on designing on top of this. And of course, no cement, no abutment on your final restorations, reproducing precisely what took you months to create. And this is very important. Not only the immediate results, but over time. So this is the immediate aesthetic of this case. And here you can see the X-rays and the actual depth of those implants. After 15 days, it was already looking like this, so it was looking promising. And this is after 10 weeks post-op. Okay? So after 10 weeks, I unscrewed my restorations because I wanted to work again on the profiles, and I went to the digital world. So I took an individualized impression. At this moment, I still didn't have my intraoral scanner, and I shared all this information with João. You already know the case from the beginning on, but now he has all the information, and we start discussing.
So in that time, João sent all information to the lab, and we can analyze everything together with the team. And João asked for level the zeniths to a perfect level, and to look for the incisor sizes and every stuff. And to work on that profiles, we have to increase that emergence profiles, and we can do it really easily on ExoCAD. That's the software I use in the milling center. And we can manage the profile till the level of the gingiva. And after that, we can work on the other part of the emergence profile. We can pick up like a freehand tools, and we can design that type of design will allow us to put the profiles a little bit up in that case. And that's a really big advantage. I can work the profiles directly to the implant level. After that, we send the PMMA milled crowns to João, to the patient.
So now I get these crowns, and I again start working on my profile, aiming for what I think is the best case scenario for this patient. So as you can see here on the image on the left, you can see where the PMMA crowns are making pressure on my tissue. They're redesigning that shape to a better outcome. And here you can see the X-ray. A curious thing, look carefully at the X-ray, and you can see how immature the bone still is. Okay, so 10 weeks time. This is the PMMA restorations, and look after 5 weeks time what they did to the tissue. The tissue now looks way better than before. Only 5 weeks with PMMA.
So after that, João said to the laboratory, everything is fine, we have to respect that profiles that are completely ready. So the only thing we have to do is open the file from the provisionals and make a little bit of cutback to produce the zirconia crowns. After that, I sent the structures to Sarah. She's a good friend of us, and is one of my partners in DMT. And she's an artist with the ceramic to produce that final restorations with a really good looking at the final.
So I get these beautiful pieces of art. They are the final restorations. Now, as you can see, there's no pressure being made on the tissue. You can see that clearly on the images because we respected perfectly what we achieved with PMMA restorations. This is placement day, and this is 3 months, 4 months, 4 months and a half, 4 months and a half from our beginning situation. So we went from this situation to that situation with one surgery, with one impression taken, okay, and in 4 months' time. And even more important, stability, tissue. And look at the tissue now. Okay? And this done with tissue level implants. So this for me is very important message. This is the first tissue level implants that I see that are perfect for aesthetic results. Okay? There are no indications that I see that cannot be applied with these new tissue level implants, these multi-level implants. So again, a look at the final restoration, the beginning and the ending in 4 months' time. And now look at the X-ray. Look at the bone, how much more mature it looks. Look at how it accommodated well. And this is due to no cement, no abutment. This freedom that we now get. Let's go to case number 2. Another tricky situation. I like tricky situations.
Sometimes.
And I like challenges, yeah. So this is a 60-year-old lady with a lack of keratinized tissue in posterior region and only 1.5 millimeters of tissue height. Okay, quite sure you all agree that creating an emergency profile in this situation is not easy. Normally we'd go with grafts of some sort, but I try something different. So what I did is this. I have cutted the bone to a level below the peaks of bone to the adjacent tooth. And therefore, I placed my implant in a depth enough that the pink color lies beneath the peaks of bone. Like you can see here on a closer view. What this had up is that after I did this, I was able to gain these more or less 4 millimeters that we've been discussing. So it creates space for clot, then increase tissue height, and then create an emergence profile, not that flat thing that food can go everywhere and we don't design an emergence profile. And this is done by cutting like 3/4 of what we needed to gain. Just suture above and wait. Single surgery, no graft. After 3 months, one thing very important, sometimes, and we're trying this often now, if I want to enhance my soft tissues, I'll use an individualized zirconia healing cap, which now is possible with Matrix. So sometimes, and particularly if I'm using bone level Matrix, I'll use this. I'll take an impression, an intraoral scanner, and it will mill me a structure like this, and I will substitute the one I've just made with this one, and with very good outcomes. So after 3 months, this was the scenario. I removed this and I had this tissue, this emergence profile, ready for my final restoration. So all I did is take an impression, send the message to the lab, this guy can work.
Exactly. At that point, we have everything we need to produce a monolithic zirconia crown in a perfect way. We have a completely designed emergence profile. One more time, we can correct in that step something we want to improve, but the final result is really aesthetical and with the correct emergence profile crown.
So in this case, monolithics. I really like monolithics. I'm sure you all do. And this is the placement day from this crown. So in 3 months' time, we went from that scenario to that scenario, and with this amount of bone stability on top. And in placement day, look how mature this tissue already looks. Look how the profile seems correct, the anatomical crown looks good, and the anatomy is respected.
And now we will talk a little bit about the lab view of the matrix, how to mill that connection, how to deal with that, okay? For me, the most important advantage of the matrix is the freedom of the emergence profiles, okay? We are completely free to design what we want, what we need. Sometimes, like Joel showed before, it's really complicated with the tissue levels, achieve a really good result. In the first point, I will show you the contact surface, one of the most important parts in the crowns. 2 years ago, more or less, we start to mill just an STL file, and we have results are not so good. But after that, we develop and improve every time a special strategy to mill that connection. And what we do, for that perfect surface, we have a round drill a lot of times. I will show you a next video about the way of the tool, that lines are the way of the tool, and the amount of the ways of the tool. Just the space between that tiny lines are about 0.02 millimeters. So after that, we can achieve a result like that before the sintering, okay? And after the sintering, we have a shrinkage, about 20% of the zirconia, so the precise are increased a lot. The second point, the fitting and the allowance. For that, for us in the lab, the 3 team create a verification tool with 2 different allowances, the maximum and the minimum, and we can check easily in the lab if the crown are going to go or not, or if we have to change some stuffs. And just to take a look in that pictures, we can look the really, really good fitting on the implants, and that's the way we want to achieve. And in the third point, the screw channels. We can't forget we are milling directly in the implant, so we need a really flat screw seat, and we will use flat tools to do it with careful tool. And sometimes what's happened during the milling, it's the powder in the corners inside. You have to be careful. In the beginning, I don't look for that. But after that, after the sintering, even, you can look for that in that crown. And this is a problem for the resistance of the crown. So what we do, we have to clean really well. We can use soft brushes, we can use compressed air together, and we can steam the crowns with careful. And after that, if we use a steamer, we have to put to dry it before put on the oven to sintering. Okay. And that's the result we want: a perfectly flat contact surface with the screw. We have 4 types of the screws, really quick: 2.25 to metal restorations. Now we have a 2.6 for angulated screw channel. The most common we use till now is the 2.8 screw. And we have for PMMA 3D printing a 3.25 screw. And this is really important. This is a really big thing. We have a clinical screw to put in the crown in the mouth, the placement day. But in the lab, we should work with that lab screws. It's that concavity part. It's really avoid the damage, the connection of the matrix till the clinician. And now we can do angulated screw channels perfectly milled directly to the connection. And for that, we use a special T-tool, like Rafael showed us in the morning, and a special strategy tool, a lot of work behind that. And we need, for sure, a special screw, a 2.6 angulated screw, and you need an angulated screwdriver to the placement. We can achieve up to 20 degrees of angulation to correct the implant placement. We have a simple case over there, a canine implant on the force, and we usually have to put the implant with that inclination too because of the root of the canine. And what we do, we design the crown, just push a little bit the screw hole to the middle of the restoration. One of the first we do.
Okay, now to our final case. And this case is very dear to me. This is a lady that I'm quite familiar with. She's 71 years old. She lost her teeth many, many years ago, 20 years with full dentures, and she has a heart disease. So we decided to do this completely, fully digital. Nowadays, you have softwares that can allow you to work and communicate with your patient exactly what shape of tooth she thinks looks best on her, and you can discuss this all in the virtual world with pictures. Now, the dots you see there on the left are from the DVO guides I made. So after I put a little bit of composite on the vestibular part of the teeth, I'm sorry, the English word just missed, on top of the teeth, so I understand perfectly what's the match for the virtual world. And after that, all is planned and prepared virtually. So all these tools you see here are going to be 3D printed and sent to me, and João, meanwhile, will be milling the PMMA provisional restoration. So I will have everything on the day of the surgery. In this particular case, so that you know, we went for flapless surgery on the upper jaw, and in the lower jaw we opened because we needed to create a plateau, a shelf. Okay?
And for me, that project started almost 2 years ago with that great team. And I'm really proud, and I want to thank you a lot, the opportunity to learn with you guys. And the improvements we do in that 2 years are a really, really big thing. And for me, that freedom, like I told you before, it's a really, really big plus for us in the lab, but mostly for the final restoration at the clinic.
So this was the day that we brought João into the table. Remember, guys? Yeah. It was a very nice dinner and profitable one, because now we get to be here with you. So for me, Matrix began a little bit early than this, but all the time I want to bring this guy along. Because I think with Matrix, this communication needs to be tighter than ever before. No longer we have tie bases in between us. Okay?
Exactly.
So, for me, just a couple of days ago, somebody told me something. The implant dentistry world is kind of the smartphone world, you know? Because there's no revolution anymore. Things are slowly evolving. I've been doing implant for 16 years now. This is the first big revolution I ever see. And I'm really glad to be part of this, really. So thank you guys for having me on board. I really feel privileged about it. And for me, it's all about being cost efficient, being time efficient, and be more predictable in my outcomes. So in this way, I can better reproduce the results I was aiming for. And this is all about tools. This is the proper tool. This is the better tool I've seen in years. So thanks, TRI, for thinking about things and for creating things like this to us. Because in the end of the day, all we want is to mimic nature and to give life back to our patients. We want them to smile without being ashamed. We want them to bite without being afraid of losing or breaking something. And we want them to kiss their loved ones without, again, being ashamed or afraid. So it's all about the patients like Anna, a dear patient to me that you saw in the beginning of the day that Sandro kindly showed you. It changed their life, and we keep changing lives. That, for me, is the main message. And Matrix is the better tool to get to this objective. So thanks, TRI. We'll leave you with this.
Face not spoiled by beauty. I have some scars from where I've been. You got eyes that can see right through me. You're not afraid of anything they've seen. I was told that I would feel nothing the first time. I don't know how these cuts heal, but in you I found a rhyme. If there is a light you can always see, and there is a world we can always be. If there is a dark that we shouldn't doubt, and there is a light, don't let it go out. And this is a song. This is a song.
Oops. Almost.
Thank you very much, guys, for this
Welcome.
outstanding presentation. Very emotional.
Yeah, I get emotional every time, you know that.
And presents. One and one, please.
Thank you, my good friend.
Thanks, guys.
Thank you, thank you.
We have several questions actually. The first question to this full arch at the end is,
Yes.
what stack guide system is this? How is this working? Can you explain a
This
little
is
bit
from
more
a company
detail?
called Digital for All. So we make the virtual planning, and then they go into the software, and they prepare the tools for us. Then you use your sleeves so that we can do the depth perforations. As you know, in your system, Pilot Drill is the one that commands the also, and it has draws for the final restorations as well, so everything fits perfectly.
So another simplification for you in your daily
Exactly.
life.
It's a very easy workflow.
And since I know that you are a full arch machine,
I try to.
I know, and you showed also these fantastic aesthetic results with this tissue level matrix implants.
Exactly.
I would like to ask you another question.
Yes.
I mean, we performed so many cases together, and you always used bone level for your full
Yes.
arches.
Yes.
What do you think? Does this change with the matrix now? With the
I think I'm about to change that, and probably I will go into tissue level implants from now on, because there's a lot of benefits I see in it. This particular case will be both upper and jaw law will be restored with full zirconia, and I cannot wait to see the results in the long run.
Me too.
Yeah.
And how is that when you have a 1.8 polished neck, when you have this massive angulation of in a all-on-4
Yeah.
scenario?
Okay, that's a tricky situation, but with all the possibilities that you offer us for the angulation, I guess we will be okay. We need some more trials, of course, but it will not be so different using the tissue level from the bone level in all-on-4. I really don't think so.
So matrix tissue level implants.
Exactly.
I have one more question.
That's the next step.
I have one more question to you, Joao. There was one question regarding these milling strategies you were talking about. I mean, this drill is going like 0.02 millimeters, circulating this connection. So when you compare that to a crown which is milled with zirconia just on a tie base, from the time, is it a big difference for you, or how is that working in your daily
No,
business?
because now everything is ready. It's really simple in the lab, because we have the strategies, we have everything we need to that, and we don't have to cement the TE base after that. So
That takes time to.
is a little bit better,
Okay.
at least as the same, but with really better results.
Yeah.
So thank you very much again.
Thank you. It
for
was
this
my pleasure being
place.
here. Thank you all.
Thank you.